here is we would be transplanting either the bone marrow or stem cells for you to hopefully make good new cells. Right now your cells are not doing what we want them to do. We want to improve that. So this is a way more scientific one. You do not have to memorize this. But what we like just people to see is that the stem cell really divides a lot. So this is really the big mother cell, we call it. The myeloid cell and the lymphoid cell give an idea of which one, sometimes the cancer is on one side or the other. The main important cell here during transplant is your neutrophils. You might have heard it already, depending when you go to the doctors. Your neutrophils are your baby white blood cells. That is your ability to start making white blood cells and fighting off infection. These are the first things to appear after transplant. They tell us, okay, you're about to get all your white blood cells back, then your red blood cells, and then your platelets are coming back. So your doctor is going to be very focused on the neutrophil number. You'll hear that a lot. If you want to impress them, just say, what's my neutrophil number today? They'll think you're a doctor. They will be blown away. Okay, so as we mentioned quickly, there's different types of transplant. The autologous is a self-transplant. That's when we collect and freeze your own stem cells, and then they're reinfused at the time of transplant. They're the most common type of transplant done around the world, most commonly done for multiple myeloma or low-risk leukemias and lymphomas. But at the same time, they work very, very well for the right illness. They have a little bit of an easier time recovering because your body's going to recognize it as itself. Then there's allogeneic stem cell transplants. So those are the transplants that I work with. This is when you're using stem cells or bone marrow from a donor. It's found by a blood test called HLA typing. The donor can be a sibling, which we sometimes refer to as matched related donor, MRD, or a matched unrelated. We call them MUD. So we have it's a very nice name, but a MUD donor would be somebody through the registry. Some people don't have that, a matched related or a registry donor, so then we would do the third option, which is called a haploidentical. Haplo donors are half match, so that's either your parent or a child, where you have 50% of the DNA that matches. They are a newer type of transplant that actually does quite well for patients. So we have a bunch of options if needed. So things to know before admission. We say you must sign the consent form for transplant. It does not necessarily have to be done before you're admitted, but it does have to be done before you start your conditioning. We're going to explain the risks and benefits, the alternatives to you, all the chemotherapies you're getting, and then you'll sign for them. When you're called in from admitting, tell that there's a bed for you. You're going to go to the admitting office, which is down by 210 Street, right behind the cafe. Check in.
Which mistakenly says patient logistics.
It says logistics.
But it actually is admitting.
Yeah.
God forbid they use the same name.
Right. Nobody knows what logistics is. So it's logistics or admitting. It's right by the main entrance. And then we'll send you up to Northwest 2 where you'll be admitted into a private room.
I'll call you back.
Okay, so these are starting with the rules. Okay, so most important, you are limited to your room until your white blood cell count recovers. That means the day you come in is the last day you'll be stepping outside of that room. You're going to be in that room for a minimum of 2.5 weeks until your counts really recover and everything looks good. You are confined to that room. So it is a bigger room. You do have space.
I would say minimum 2.5, but often likely 3.
3 is realistic.
3 is realistic, especially for transplants with other people's cells.
Yes. That's when you're looking at 3 weeks.
Yeah, but if I want to go jogging, I can't come up.
You can go,
Go around your room.
Oh, I can run around the room?
Yeah, you have to move the bed into the center and just do.
There's no visit.
There are.
So we'll get
Yes,
that.
we'll get to that.
So we ask that you keep your room clean for your protection. Actually, things like my plate's clean, but if I had some crumbs on here, that can encourage some bugs or bacteria to grow. Water bottles that stay out, or a cup of water that stays out for over 24 hours grows bacteria. So if you're not using it, throw it out. Keep it clean. That's how you'll be safer. We ask that you shower daily for your protection. Remember, we lowered your immune system, your ability to fight off infections, so your skin is actually your biggest protector. We want you to keep that clean to decrease your risk of an infection.
Will you be able to do this by yourself, like shower and
So you have your own bathroom. Depending how you feel, if you really feel weak, I can't get there, you can ask for assistance and they'll stand by or provide whatever support is needed. They are the handheld showers. We do have your own bathroom. If there's a day you really feel like I am unsteady, that would be the day, not necessarily to skip, but to ask for the bucket and you can wash up yourself at the bedside. We want you to be clean, but we want you to be safe first.
And there's a special soap that they're gonna give you. It has no scent and they'll give it to you throughout the process and it just minimizes any of it's a stronger soap. So it's gonna minimize any bacteria that's on the outside of your body.
So things like the fragrance soaps, which we all like, actually that might be too much and overwhelming to you during transplant. Your body's very sensitive, so you're better with the plain, unscented things.
So that means that when I come here, I gotta bring the plastic things that I use, like,
So
because
you-
I got this.
You
I
can,
got plastic in the house, so when I take showers, I put tape around it.
you can bring if you have them that you're comfortable with, but they will have, I forget what they're called, Aqua Shield or something. They have these big,
No, I'm talking about for my hands.
Yeah,
Right,
but they're
they
the same thing that they would put
They would
here,
cover
they
it
would
here.
also cover
Oh,
with
okay,
this.
okay, okay.
So if you feel more comfortable
No,
and
no,
wanna,
no,
Okay.
I just wanted, just in case, cause I got some home
yeah.
yeah.
that I.
That's why you can throw
put
them in your
here.
bag if in case you feel like you need a backup, but if you're comfortable with ours, use ours.
Yeah, okay.
Okay? They'll make sure you have what you need. And then we say, we want you to have recent blood work about a week before you come in. That just makes your first day go a little faster, or else we have to wait for all the tests. So visitors, you are allowed 2 visitors at a time in the room. You can bring your family all together if everyone goes in the same car. We just ask that some people wait in the day room and take turns. Nobody under the age of 12, and definitely nobody who's ill or has recently been ill. And even if they say it's just allergies, oh, it's nothing, do not take that risk. We put you in there to keep you away from bacteria. Don't let anyone bring germs in. Okay, we usually recommend you can have, if you have one family member that's going to be coming a lot or something, you can have them as your bouncer. They can clear your visitors. Okay, are you sick? Are you healthy? Just make sure so that you don't have to be the bad guy. But it makes sense not to let anybody come in that's sick.
Well, what about me? Like I take dialysis.
Mhm.
I can.
Dialysis, so that doesn't mean you have an infection. I'm thinking more like the flu or chicken pox.
Oh.
That's just a
Like
chronic.
even a sniffle.
Yeah,
It's
it's a
just
sniffle.
it's one of those things where it's not worth taking those chances. So
Okay.
if someone's
Gotcha.
just if someone when you wake up and you don't feel so good, please don't come.
Okay.
And the other thing to know is also during transplant itself, do we have this on a later slide? Only one visitor.
Oh, we don't have that in a link. Yeah, 1 visitor at a time during the actual infusion.
Just because it's going to be a nurse and a PA with you the whole time, so we don't want too many people. But definitely people can kind of take shifts.
Yeah, a lot of people do that. They have bring the family and they just switch in and out, and that's fine. We just want it for your safety. And again, everyone, I think you already read it in the food thing, everyone must wash their hands before entering and exiting the room.
You'll see there's a little sink right outside.
Yeah.
So you can do that before you go in and out.
So there's no excuses for family, visitors, and staff. Everybody has to follow the rules. And then the next one, all visitors must wear a mask and gloves at all times. My favorite one is where I see you sitting there with the mask, but it's down here because your visitor's eating. No, that does not work. Visitors are not encouraged to eat in the room because you cannot eat with the mask on. So the mask must stay on and be on your face. Again, all for protection. That goes for doctors and your coordinators and nurses. If we come in the room and we don't have gloves or a mask on, make sure you kick us out right away. Everybody is held to the same responsibility, okay? And everyone will follow it. No overnight guests are permitted. Again, that's just for safety. There's not enough, Nikki, there's not enough room in the room for a second bed. And then no live plants or flowers because they actually do have a lot of bacteria. So fake is fine, balloons are fine, hearts are fine, no gardens. Okay, so on the day of admission, admitting or logistics, we'll call you and say that there's a bed available. Ruby and I might give you a heads up a week before. Some people know their exact day. You know your exact day and
Yeah, you said the 24th.
you got it. Other people, you'll get about a week heads up and they'll say, okay, get ready, in the next couple of days a bed will be ready for you. Your first stop will be,
Based on that, what's a little bit hard is we only have 7 transplant rooms, and I know it sounds very simple, but someone needs to leave that room in order for you to go in. So what can often happen, especially when if you're getting cells that have already been collected and are frozen, there's more flexibility than someone who's getting cells that are from a donor from a different place that we have to fly in, right? So if your cells are frozen here, or you're receiving cells that are frozen here, the day is much more flexible. So Lori and Ruby could call you and say it's 1 or 2 days, or we think it'll be tomorrow morning, but if the person who's in the room we wanted to give you wakes up and doesn't feel well, you don't come in. So it's definitely a kind of a waiting game, and what's best to do, you're have it easy because you have your certain day. But otherwise what you want to do frankly is be like a pregnant woman and have your bag packed ready to go, because the other issue is if we call you and we say that bed's ready, you say sorry, I can't come in for 24, 36 hours, we give the bed to somebody else, okay? And so we totally understand that it's very inconvenient, don't travel too far away from home, be able to be like, okay, in 4 hours I can be there.
you're allowed to be at your family's house and say, I'll be there in 4 hours, but don't go to South Carolina.
Yeah. Or you can, look, just give away your bed.
Yeah, yeah, you do it. So again, you're gonna stop at logistics and then you'll come up to Northwest too. As Sarah mentioned, there's a special soap that we would require you to do once you get there to decrease the bacteria on your skin. It's called HepaCleanse, it's a pink bottle. Actually, I think it smells quite nice. But you'll be able to use it throughout, so even if you just showered, when you first get here, you'll be showering again. Then, as Nikki was telling you, you're gonna get a central line placed. The same one you might have had for chemotherapy before, usually placed in the neck right above your clavicle bone, which is called the IJ line, and that one will be placed for your chemotherapy and for your stem cell infusion. It's placed right at the bedside, they come in and do it in your room, and it helps so that you can actually get blood drawn right from here. You don't have to be stuck, you get all your chemo and all your meds through it. We will leave it in place for the chemo and the transplant, and then usually remove it 2 to 3 days after transplant. If you have very hard veins, difficult to get an IV, difficult to draw blood, talk to the doctors about leaving it in a little longer. The reason we want to take it out early as possible, any more lines is a risk of infection. So we always balance it out on safety. Did I get that right?
Yeah, would you take this, you won't take this one, all right?
There's only reason they would take it out is if you start having fevers and we can't figure out where they're coming from, we would take out all your risks of infection,
Oh, okay.
okay? So that goes for anyone else too. If you start having fevers and you have either a portacath or something implanted that's maybe not 100% necessary, they might remove it for safety. Usually not though. We're gonna skip radiation because nobody in this room is getting radiation. So chemotherapy will start as soon as your blood work is cleared. Like I said, if we do it 1 week before, that'll speed you up. We can start chemo as soon as we get that line in. And chemo is given over 1 to 8 days depending on your diagnosis. Multiple myeloma is usually 1 to 2 days. Leukemias are usually 8 days. And then everything in between, there's 6-day regimens, 5 days, so your specific doctor will let you know which chemos you're getting and for
Yeah,
how long.
but, excuse me. The girl in the front office, in the front, she told me that the
Then remember, the chemotherapy is being used to destroy your cancer cells. That is the #1 treatment you're getting. This high-dose chemotherapy is going to go in there and kill all the cancer cells. But it also kills your normal cells, which is why you get side effects. Side effects, nausea, vomiting, diarrhea, loss of appetite, temporary hair loss, and the #1 that everyone gets, weakness and fatigue. You are not going to necessarily get all of these. You might only get weakness. You might feel great most of the time through. These are just the common options. And again, this is because the chemo's working pretty hard to fight the cancer.
How long does it take for your hair to grow back?
No, that's
It's hard
really,
to say, right?
it's hard,
I would
depends
say
on
it
hair
depends on the
growth, yeah.
person, but I would say
Three?
two months is when you start. It also, in fairness, it grows in a little funny. It generally grows in not in a uniform way. You usually have, unfortunately, kind of like
Just
stray.
at first.
No, not at first, but you
Yeah.
have like little stray hairs, and then it'll start to grow. But I would say 2 to 3 months is about when I go. And what's funny is people often say that the hair that comes back initially is not like the hair that they lost.
Lighter and sometimes curly.
Right. And generally after over time it goes back to what it was, but the initial growth is often different than what you lost.
And you don't lose the hair until you're almost ready to go home. It's usually not till like 3
I'm
weeks.
losing hair now.
You lose it. Usually the big hair loss from this is towards the end of the transplant. So when you go home and then 2 months after that it comes back.
You mean I'm gonna be looking at you, Burner?
Yeah.
At home, at home.
Can't with you.
Okay.
It's hard to keep up. It's hard to keep up with you. The other thing that I think is super important is you guys have had chemo in the past and you've had side effects from that chemo. The truth is when you get this chemo, your side effects could be very different. Every time you get a different chemo, you have a different reaction, and every person has a different reaction. The really one thing that we can absolutely guarantee is the weakness and fatigue. I would say 95% on the hair loss too.
Yeah.
But the other ones are just a matter of how your body's reacting, so it's going to be really important for you to make sure you're communicating to the nurses what you're feeling. There are a lot of great drugs here, okay? There are a lot of great medicines that we can give you inpatient that are harder to give outpatient. Use that to your advantage. Don't wait, if you're feeling nauseous, don't wait until you throw up or feeling terrible. Tell the nurses, let them give you some meds. Let's make it easier.
You don't need to feel any of these things.
Yeah.
Feeling nauseous does not mean your transplant will work better. That'll mean you're more miserable. So take the meds, be comfortable, and get through this as best as you can. Okay? So once your blood counts drop, that's when you're at risk for fevers, infection, bleeding, and mouth sores. So those are the side effects that we're going to be looking for you very, very closely. Any signs of any of those, you let the team know right away. Sometimes it happens, your platelets will drop, you might be a little bit of bleeding. The faster you notify the team, the quicker we can get you a platelet transfusion and stop
Bleeding from where?
Depends, sometimes it's the gums. A lot of times, if people have IVs that get irritated, there can be a little bleeding around that site. And rarely, but happens sometimes, there's bleeding in the urine. Any of those are just because your platelet count might be very, very low. Once we give you the platelets, it'll stop, but the second you see it, we want to know about it.
And it's the same as when you're when you
Yeah.
go home, right? Anything that you see that seems a little abnormal at all, let us know.
Okay, so this is Richard's favorite slide. To always remember that bone marrow transplant does not involve surgery. It does involve high-dose chemotherapy, possible radiation, not for you guys, and the receiving of the stem cells. So on the transplant day, you'll receive the stem cells in your room. It is a very similar process to a blood transfusion, where it's a bag that looks almost reddish, sometimes a little brownish, and it is going to be hooked up to your central line and infused by gravity. We give you pre-medication before to alleviate some of the possible side effects. If your stem cells, like Sarah said, are frozen and collected in advance, they're stored in a preservative. That preservative is to help the cells from breaking down. The only side effect from that is this garlic-like odor or taste. I don't think it smells bad. I don't think it's that bad. I'm so
I
used
also
to
don't
it.
even think it smells like garlic. Like,
Everyone has their own.
Right.
It smells bad though.
I don't think it smells bad. I think it's a distinct smell. I mean, but I'll be honest, as people look back on their transplants, most people don't even really think or remember or think that that's a problem.
Yeah.
And the only thing that you can sometimes do if you want to bring is some kind of sucking candy like a lemon or a pepper, something that's strong, because your taste is attached to your smell, and if you wanted to suck that through it, but people generally don't have too much trouble with the smell.
But they do like that. The suck-on candy really does make it go down. The smell, actually the patient themselves won't notice it as much, the family members will, because it really comes out of your respiratory tract, so it comes out of your mouth and your pores. So you might not even notice it, but if you say, what is that little funky smell for the next day, it's you. It can also cause a little bit of mild nausea. People say there's a tickle in the back of the throat while the stem cells are infusing. Again, that's the preservative, and that's where the mints will help. But we give you anti-nausea medicine prior, just to help prevent this. And the PA or nurse are in the room the whole time. So if it's not enough, you need something else, they'll be ready to give it to you. We make sure we have you totally covered. Some people do throw up. It's, just might come on very quickly and stop, but we will not have you sitting there throwing up for an hour. Okay? If you notice any symptoms, difficulty breathing, change in your vision, anything that you think is not normal, just let them know right away. So daily treatments after your transplant is going to be blood draws, platelet and blood transfusions, IV fluids, antibiotics, and oral medications. You're also going to start receiving Neupogen 5 days after your transplant to help stimulate your bone marrow. So if you've collected your own cells, you did 2 shots of Neupogen a day. You're going to do 1 shot of Neupogen a day to help you recover. It's very similar to the Neulasta that you get at the end of the chemo, except you get it as a daily shot. It's going to help encourage the stem cells to do what they need to do. Once your counts go back to normal, we stop it. Okay, so as soon as your stem cells are infused to the bloodstream, they make their way back into the bone marrow. Then they start dividing and making, go back to that first slide, start making the platelets, white blood cells, and red blood cells. That process is called engraftment. It's another term you're going to hear a lot, just like neutrophils. So when they start seeing neutrophils, they're going to say you're starting to engraft. The reason you care about this word so much is engraftment means you are much closer to going home. I want you to think engraftment means I'm going home. So once you engraft and your counts are good and stable for a couple days, you're out the door. Okay, so that's why you're smiling like that.
And no, we're not the dentist.
Yeah, so we're not the
That
dentist.
reminds me of the.
Again, it's important to maintain good personal hygiene, shower at least once a day, and avoid their use of razor blades. So for shaving, not that it's usually a high priority, but you can use an electric razor only. If not, just let it go. Most likely it'll all fall out anyway. Okay, graft versus host disease. So this is important for the allo transplants only, the people getting transplants from donors. It's a possible complication after an allo transplant, and it can be either acute or chronic. What it is your...
Somebody's calling somebody.
Somebody's phone's ringing over there.
No, I think it's over there.
Oh, it's over there? Okay. So what it is the donor cells not recognizing your body as itself. So donor cells actually trying to attack you because you look foreign. We always say a little bit of it is good, because a little bit of that, what it means is while they're attacking you, they're also attacking any cancer cells. So that's a little small skin rash or a couple days of diarrhea could be a good sign. That means your transplant is working well. It doesn't necessarily have to happen though. What's a problem is when it becomes more severe, when you get a very big skin rash, when you have a lot of diarrhea, or if we start to see some change in your liver numbers. That's when the graft is working too strongly. You'll need to come into the hospital most likely if it's too strong, and we'll treat you with steroids and back to IV medications to help control it. Once it's under control, you get to go home and we start you back on your medication. If it's mild, we can treat you in the clinic, send you home with oral steroids, have you come back in a week, IV medication in the clinic as needed. This is what you are going to be looking for. We always say early recognition is key. Like Sarah was saying earlier, this is one of the cases where if you stay at home for 2 or 3 days with this and wait till the 4th day, you will need to be admitted for sure. If you come in on day 1, you just see a little skin rash, you come right in, even if you don't have an appointment, we'll be able to treat it right there and send you home. Sometimes it needs to be diagnosed by a biopsy of either the skin, liver, or GI. Usually it's treated with steroids. So this is the number one thing you guys are going to be looking out for. You're going to hear a lot of either graft versus host disease, or you'll hear them call it as GVHD. It's the number one thing you guys have to have on your minds. Okay, road to recovery. So we want you to remember that once you are sent home, you're still on the road to recovery. It can take several weeks to months for you to really regain your strength and appetite. We want you to talk to your doctors about when it's safe to return to work or to travel. A lot of people are very anxious to get back to their normal routine. We want to make sure you go back in safely. Your counts are fully recovered, you're strong. We don't want you going in and out and having difficulty if you travel and need to be admitted into a foreign hospital. So they'll tell you week by week as you're coming in for visits where you're doing in your progress. Most important, a lot of you will be going home with your actual medications in hand. Sometimes for the autologous transplants, you get sent home with prescriptions.